Well, hello and welcome back to class. This is Holistic Therapeutics, HT 400 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is Lecture 5C, where we will be discussing preparing for a reflexology treatment session. And in terms of our 5C lecture objectives, at the end of today's lecture, students will be able to identify how to prepare for a reflexology session. Students will also be able to identify how to create a case history for a client, understand the correct method for assessing the foot for ailments using foot charts, know the importance of touch, and understand some of the common problems with feet. We begin our lecture today by looking at preparation for treatment. A reflexology session should be an hour of relaxation for the client, so offering a calm, comfortable environment alongside reassuring competence is an important part of the experience. Both you and your client should always feel relaxed and at ease. You should make sure that the room you are planning to use for treatment is sufficiently quiet and that you are unlikely to be interrupted during a session. Everyday noises such as passing traffic, ringing telephones, or audible conversations in neighboring rooms may all disturb the treatment and make it difficult for your client to fully relax and for you to concentrate on what you are doing. On the other hand, some pleasant, relaxing music in the background will help set the mood. So you may even like to light an oil burner or a diffuser, and that will send out a fragrant aroma to enhance your client's experience. But also remember, with the type of aroma that you use, the fragrance that you use, it should be an essential oil that is proven to be relaxing for the most part, and many times we will use lavender. But you want to make sure that you also give the client an opportunity to choose the scent, if you will. So just, play that a little bit by ear. But for the most part, you want to create an ambiance of relaxation and a stress-free environment. So let's talk about the rhythm of a session. When you are planning your schedule, you need to allow about an hour to spend on each client with a short break between clients. A break between appointments will give you time to wash your hands, have a refreshing drink, and prepare for the next appointment. It also leaves a few minutes to spare in case your client happens to be running late. So the very worst thing you can do is rush through a treatment. It undermines the whole principle of reflexology, which is that it is a relaxing therapy. So if you are stressed because you are trying to meet a quota in terms of the number of clients that you see within a certain time frame, that will show up in your session and you will transfer that stressful negative energy to your client. So we want to be sure that we schedule our clients where we can comfortably see them and also put our all into each session, which is what your client deserves. So there are some cases where you will see it happens a lot of times with new therapists, and sometimes they tend to overbook or book too many clients within a short time span. And what they're really doing is they're setting themselves up for burnout. So yes, we do have to make a living, but we have to do it in a way that is balancing to our health and our client's health. So this is a good general rule. Always schedule an hour for your client with some time in between sessions before you just, seek to have clients back to back like that. And this is something that you will learn how to do as you gain more experience. Now, in terms of home visits, they are becoming very popular, particularly for elderly or disabled clients who may be unable to travel to you, meaning to your clinic. So many practitioners are now obtaining work in residential care homes or nursing homes, and a weekly visit is very welcome, not only in easing aches and pains, but also in providing an elderly person with someone to chat to and listen. Communication itself is a wonderful healer. So when clients arrive, first ask them to take their shoes and socks or tights off, and then sit them on the therapy table or in the chair. You want to start by wiping their feet with medicated wipes that cover their legs with a large clean towel and take their case history. This is a chance to both assess the feet and the client as a whole, to observe and discuss any particular problems, and to take relevant notes. A few relaxation exercises precede and follow the actual reflexology treatment, and this enhances the whole experience. And of course, we did cover in our practical training lectures the need to adopt a professional approach. This refers to your attire. You want to dress as professionally as possible. Trousers and a plain white tunic look very smart as always, but it is important to look clean and tidy. Do not wear bracelets, jangling earrings, or rings. This includes nose or fingers. And in particular, you want to make sure that your hands are well manicured with short, clean fingernails, no nail polish, and your hands, because they are the tools of your trade, you want them to always look their best, but you want them to look clean. So it's a good idea to display your diploma of reflexology on the wall of the room in which you are working, together with any certificates you may have, such as memberships with associations. Some people put first aid certificates also on the wall. Also malpractice insurance. The whole thing about the insurance, it is important and you will have it. I am not sure if I would hold very fast to that. The most important thing is that you actually have malpractice insurance. So I suppose if a client wanted to see that you actually did have it, I guess it's nice for it to be on the wall. But the most important thing would be the diploma that indicates that you are qualified and you do have the certification in that area. So clients do have a right to see when and where you were certified, and to be able to reassure themselves that you are a member of a recognized association, that you are insured to practice, and that you would be able to handle competently and confidently any situation that would occur during treatments. So let's talk about taking a case history. In order to obtain good insight into a client's lifestyle and medical history, you need as much information from them as possible. So taking a detailed case history will give you a very clear picture of the person you are about to treat. A record form or card will cover all the questions you need to ask to obtain a full case history of your client. You can either ask questions and fill it in yourself, or get the client to complete it. When the form is completed, the client should sign it, thus giving their permission for you to treat them. When you start treatment on the client, you should bear in mind any diseases, operations, or injuries that have been mentioned, and taking care around corresponding reflex points. And as always, if you can get the client to fill out as much information ahead of time, that is always preferred, because then you can review what they had given you in terms of their information, and if you have any additional questions or if you need further clarification, you can do it at the time when they first arrive. but it will save you some time if you are able to get as much of this information ahead of the treatment. So that's just something to keep in mind. But, of course, if you can't, you can't, because sometimes, even in this day and age, there are still folks who are without internet access, and that might be their only way of being able to get the information, would have been through some email or what have you. But again, you just work with the client where they are, and if it is possible for them to do it ahead of time, go with that option. But if not, you just take them where they are, take their detailed case history, and I guess also it gives you a chance to build that rapport with your client. So that's very important. So in terms of infectious illness, it's always inadvisable to treat a client during the acute stage of an infectious illness. The stimulating effect of reflexology tends to create a detoxifying effect on all the eliminating functions of the body that occur in the lungs, the kidneys, the bowels, the sinuses, and the skin. During an acute infection, the body is already desperately trying to rid itself of an accumulation of toxins. So stimulation through reflexology will encourage the body to go into overdrive to eliminate even more toxins and make the client feel even more disturbed and unwell than before. So do by all means work on techniques to create a feeling of relaxation in the client, but you want to avoid those organs of elimination at an acute stage of illness. In cases of high temperature, you may also like to work on the reflexes of the pituitary gland, and this is beneficial in lowering temperature. But in general, however, it is best to begin treating the client after they have recovered from their illness in the passive stage. So my strongest recommendation, although you will have reflexologists out there who will treat and perhaps treat less vigorously and avoid the eliminating functions, organs of the body, as we already mentioned, and they will treat other parts. But I tend to err more on the conservative side, which is to wait until the infection or the illness is not as acute and well into the passive stage. And I believe that the client will get more out of it because their body will have settled down a bit. So I would strongly recommend that you wait, no matter what it is, to provide a treatment when you know for sure that the client is in a more settled state. So let's talk about the intensity of treatments and its effects. Although reflexology is a gentle treatment, it is also very powerful, and there is a possibility that it can cause someone, particularly in the elderly person or someone in poor health, to have an extreme reaction. Under these circumstances, a client may not feel confident in returning for a further appointment. When clients who have had a long history of frequent medication and who are perhaps not in good health are being treated, it is highly recommended that the reflexologist undertreat on the first occasion to minimize the chances of a violent reaction. So you want to use very light pressure on such clients and do not exceed a half an hour of working on their feet, and wait for a report from that person as to how they felt the day after the treatment was given to them. On the follow-up of the first session, you might ask your clients whether they feel that their condition has worsened, if they had any bowel or bladder problems. You also want to know whether they suffered from a severe headache, and so on. So you want to be guided by these reactions. And of course, we know all of these reactions are a result of the body trying to rid itself of toxins. So if all is well after the initial treatment and the client reports a general feeling of improvement and well-being, then it is quite in order to increase the duration of the treatment session and perhaps use a slightly more intense pressure. And remember that the client is your ultimate guide. So we can't overemphasize the importance of touch. Touch is all important when it comes to familiarizing yourself with the client's feet, but you should also keep alert for signs that may be symptomatic of an underlying problem. It helps to keep a record of your observations on a simple foot chart. As you talk to the client about their medical history, you can be gently feeling their feet to identify areas with granular buildup or reflex points that are especially sensitive. You want to use the healing touch model to assess your client's feet. Do not use oils or creams initially when assessing the feet, because an oily foot makes it very difficult to isolate the reflex points. So non-oily foot balms often work well, or if the feet are very damp, you want to give them a light dusting with a warm towelette. There is no substitute for the human hand. No machine can give you the information that you can sense only yourself through touch. And this is why many reflexologists are against the use of electrical devices that can overstimulate the body systems. And many feel that we have far too many machines in our lives, which makes it vital that we reach back into the natural healing practices. Hands are meant for healing, and during each session, it is a good idea to fill out a foot chart and to also update a simpler version of the client's consultation record card after every appointment. It is a good idea to note down any significant personal information the client has told you, such as a first grandchild being born or one that is due, any exams being taken by children, or concerns over sick relatives. And when the client arrives for the next appointment, you can ask about whatever they had mentioned the last time, and this helps to create a good rapport and lasting and deeper relationship with your client. So let's discuss foot problems. As reflexologists, it's very important for us to have a firm foundation and knowledge of foot problems and foot health concerns. And I know we did touch on we went to, I would say in our last lecture, we did look extensively at various foot problems that you as a reflexologist may encounter. However, we can never overemphasize the importance of having a great working knowledge about the conditions of the foot that impact a person's health. Because medical statistics reveal that 2 out of 3 people are plagued with 1 or more foot problems, and these can often either lead to or stem from serious disorders. So abuse of the feet and the subsequent foot misalignments cause things like blisters, bunions, calluses, and corns. These in turn often lead to general fatigue and bodily aches. The converse is also true. Systematic or general body disorders such as arthritis, diabetes, multiple sclerosis, and some types of heart disease show up in the feet. Often, this is the first place they show, and sometimes it is before the malfunctioning organs have exhibited other symptoms. Foot pains can camouflage serious disease, so foot discomfort of any kind demands immediate attention not only to the foot, but to the rest of the body. What may appear to be merely a foot problem could in fact be a symptom of a systematic disease. Consultation with a foot health practitioner, chiropodist, or podiatrist to remove hard skin and deal with corns and calluses prior to commencing reflexology treatment sessions is highly recommended. And this is the reason why many of you who are enrolled in this course are also enrolled in the foot health practitioner course, because it makes sense to be able to offer the treatments of the foot all in one if you need to be able to do that. And so as much as possible, we want to be able to give our clients that one-stop shop experience. So athlete's foot, or tinea pedis, is not a disease in and of itself, but athlete's foot or tinea pedis describes an entire set of symptoms, commonly including scaling between the toes, itching sensation, and softening of the flesh. It may initially be the result of a fungus, but if it becomes chronic, roughening of the skin can follow, known technically as hyperkeratomalchisis. Athlete's foot occurs more frequently in men than in women. It may be a local problem, but it can also be the result of an allergy, a drug overdose, or sunburn. Naturopathic doctors believe that athlete's foot is exacerbated by the body's poor elimination of waste. That is, the skin, lungs, bowel, and kidney are not performing their elimination duties very efficiently. And as a result, the feet are used as an area of elimination through perspiration. Sweat is normally made up of a high-protein material in which the fungus that causes athlete's foot thrives in abundance. Often, attention to the body's eliminating processes in the form of extra exercise, hot and cold showers, and body scrubs give the body a chance to eliminate its waste through the proper channels and allow the condition to disappear. Now let's look at bunions. A predisposition to develop bunions might be inherited, but a bunion can also be exacerbated by wearing poorly fitted shoes. In some, but not all cases, the bursa, or sac over the joint of the big toe, becomes swollen and inflamed, sometimes realigning it under the toe next to it. Pressure must not be applied to painful swollen areas, so when this happens, you must work on the corresponding areas in the hand. And we have Euphy's Bunion Severity Guide. We see the mild form of bunions, followed by the moderate. We see the large, and we also see the severe. So yes, and I'm sure we've all probably seen various degrees of bunions in our life, but it is very, very interesting to see the severe form of bunion. So now let's look at corns and calluses. Millions of people suffer from corns and calluses on their feet. They can be the result of friction, abnormal foot structure, and systemic problems, or can even arise through imbalance of mental or emotional upsets. A chiropodist or podiatrist will usually prescribe salicylic and plasters to remove them. Castor oil rubbed twice daily into the affected area softens the corn or calluses so that it can eventually be peeled off with the fingers. Other home remedies include the application of a thin slice of lemon or a piece of cotton wool dipped in witch hazel. Either of these should be secured in place overnight with sticking plaster or adhesive tape. After a number of applications over a period of days, the skin usually softens enough to be removed from a gradual standpoint. So with corns and calluses, and this comment is directed towards our foot health practitioners. We know that with calluses and even to some extent corns, when we are seeing our clients on a regular basis and we are treating them, we are not going to send the callus all the way down because we know that it provides a protective layer. It is only when it gets to the point where it's causing more discomfort because it's so thick and so hard and it's rubbing up against shoes and things of this nature that we look to shave it down where it is manageable. So where our clients are concerned who are getting regular foot care, we can keep an eye on corns and calluses, making sure that we give them the education they need to select the right kinds of shoes that fit good, and also that they take care of their feet and pay attention to areas where there may be friction. And this is just a part of the ongoing process of good foot care maintenance. So as reflexologists, as well as holistic health practitioners and foot health practitioners, we need to be concerned about the ongoing maintenance of the feet when it comes to corns and calluses. Now let's talk about verrucae. Verrucae are caused by a viral infection by the human papillomavirus types 1 and 2, and sometimes 4. This virus attacks the topmost layer of the skin or the epithelium. This causes the cells to proliferate or form a growth or a raised plaque. Natural remedies for verrucae include apple cider vinegar. Apple cider vinegar continues to be studied for a wide range of health uses, including possible wart removal. Duct tape. One way to gradually get rid of plantar warts is by using duct tape. Salicylic acid is another. Tea tree oil, milk thistle, iodine, and over-the-counter freezing sprays. I don't really like the over-the-counter freezing sprays too much. I tend to lean more towards the tea tree oil used with a carrier oil. It does seem to be very effective in reducing the size of the verrucae and improving the appearance of the skin and drying, well, not drying it out, but getting the skin to a point whereby it can be well managed with any debridement that needs to take place. And so I tend to gear more towards those natural remedies. The apple cider vinegar is also another good remedy for home use. So let's talk about fallen arches. We covered foot arches extensively in the previous lecture, but here are some additional points. Many people are born with predisposition to fallen arches. Shoes with arch supports may be helpful in certain circumstances, but specifically designed exercises are preferable. It is interesting to note that throughout the centuries, superstitions or myths have developed about the arches of the feet. One such myth is that high arches are a sign of aristocratic descent. Low arches may be an ethnic characteristic and yet cause no pain. It is said that strong arches are important for healthy feet and for good support of the spine, and this we wholeheartedly agree. Rheumatoid arthritis. In its early stages, rheumatoid arthritis may appear as pain, stiffness, or swelling in the joints of the feet. The appearance of tiny lumps beneath the skin, known as subcutaneous nodules, is an early warning sign of serious ailment. You can feel these nodules and they may cause discomfort if pressure is exerted too enthusiastically, particularly during the first reflexology treatment session. When the disease has reached the degenerative chronic stage, hammer toes and bony spurs may appear. Let's take a look at gout. This is a painful condition and is more common in men than in women. It is possible to be genetically predisposed to gout. Its appearance is often marked by a sudden change in the big toe, which becomes shiny, swollen, inflamed, and extremely painful. The initial point of irritation is usually the joint at the base of the big toe, known as the metatarsal phalangeal joint, but other joints in the feet may also be affected. Gout may at first be mistakenly viewed purely as a foot problem, but it is caused by a disturbance in the uric acid metabolism, which results in raised levels of this acid in the blood. Because of the buildup of these products in the system, insoluble uric acid salts accumulate around the joints and in the tissues in the form of crystalline deposits, which can be felt when they are pressed. Let's discuss cardiovascular diseases. These affect the heart and circulatory system and may cause pain, swelling, and burning sensation in the feet if the blood circulation is impaired. Swelling and edema in the feet and legs can be caused by inadequacy, which is the inability to deal with a situation or life in general. The body fluids then accumulate in the extremities since they are restricted in their flow. Now let's discuss arterial sclerosis, and you will remember our lecture on arterial sclerosis in our foot health practice lectures that we've had. This is the hardening and thickening of the arteries, which seriously reduces the blood flow with the consequent loss of oxygen to the tissues of the feet and removal of deoxygenated blood. This leads to poor gaseous interchange in the tissues, difficulty in walking, pain when the feet are at rest, ulcers and infections, loss of hair on the legs, and thickening of the nails, particularly on the big toes, are all clues to the presence of this disorder. As we consider the diabetic foot, an early symptom of diabetes is often a numbness and tingling sensation in the feet. Ulcers may develop on the soles, and if infections occur, they heal very slowly. Now, in terms of neurological disorders, symptoms of neurological problems or nerve disorders, even brain lesions, can appear in the feet in the form of lack of coordination and muscle weakness. Okay, so we have reached the end of today's lecture, and for assignment 5C, I'd like for you in an essay of no less than 200 words, describe the steps involved in preparing for a reflexology treatment session. Include in your discussion a description of the rhythm of the session, case history, what it means to overtreat a client, and foot problems that may be present. What are the clinical reasoning indicators that you will need to consider when deciding if, when, and how to treat a client with an acute infectious illness? And this assignment is due no later than Sunday by 11:55 p.m. If you have any difficulty with this assignment, you may shoot me an email or send me a text message. My office hours are always the same, Thursdays from 4 to 6 p.m. And with that, I look forward to receiving your assignment, and I will see you in the next lecture.